I'm a social worker and hospital liaison for Hospice of North Idaho. This is a quick tips video on what I do when I meet with patients and families when they receive a hospice referral in the hospital setting. I really like to meet with them if possible the day before. There's a lot of stuff just to find out where that patient and family are at in their understanding of what comfort care means and how to make that translate into a plan of care that is successful in the home. Sometimes it's very easy. Other times there's a lot of stuff that needs to be navigated. Patients and families, they're looking at stopping interventions that have been life-sustaining for them. So that can be a really difficult conversation. Sometimes after I talk with them, I'll bring in the doctor back or the nurse practitioner to provide more information on their disease process and what that might look like stopping that intervention. Transportation is a big issue. Sometimes patients were walking before the hospitalization, but now they're bedbound, so we got to get that hospital bed placed. We've got to get new oxygen placed. How are they going to get home? They might need an ambulance. They may need lift assist. So there's a lot of details to make that patient and family feel safe. If they're going to the hospice house, IV access, we really love IV access. If the patient's going to the hospice house, if the provider can talk to them about life expectancy. Sometimes families coming in, if it's Tuesday, families flying in Saturday. Well, if we think that they have 48 hours or less, the family needs to know that. And so I am happy to talk to them about that, but also that provider piece is really important so that they understand and can have their questions addressed. Another tip for going home is we really would like that admit nurse to meet with the patient and family same day of discharge. We don't want them to return that later that night to the hospital. So sometimes that takes a little coordination. The patient is going to discharge back to their facility or to a new facility with hospice. Either myself or triage will call the facility to let them know when our nurse is planning on visiting. Also, we want to make sure if there's new medications that the patient's going to need for symptom management, we want to make sure that facility has those or that our nurse will bring them. So there's going to be a lot of communication needs, back and forth at that time, DM me as well. And another quick tip is if you have a patient that might not be ready for hospice, but you think they could benefit from a hospice conversation, we're always happy to meet at the hospital and just see where they're at and answer their questions and hopefully make them feel more at ease.